All right, now we want to go to another question from one of our debate partners at the Gannett newspapers of Massachusetts. Here's a video question from one of Gannett's editors.
Hi, I'm Rebecca Hyman. I'm an editor at the Enterprise in Brockton, which has the second highest rate of coronavirus in the state, as well as a large immigrant population. Some local officials and activists have told us that sometimes immigrants continue to work even if they're sick, because they don't qualify for unemployment benefits and have no other way to put food on the table. Would you support a temporary unemployment benefit for undocumented immigrants as a way to slow the spread of the virus? And if not, how would you address this issue?
Rebecca Hyman from the Gannett newspapers, thank you very much. So, Mr. Kennedy, she's asking about a temporary unemployment benefit for undocumented immigrants during the pandemic. How do you respond?
Yes. Look, you're not going to solve a pandemic by forcing people in our country to go to work and enable them to spread it. The whole point on a pandemic is that your health and well-being is linked to mine. And we need to make sure that we have the policies in place to allow for individuals who are sick to be able to get well and get healthy and not transmit the virus. Yes.
How far are you willing to go with this principle, Mr. Kennedy? Rebecca's question was focused on the pandemic. Should undocumented immigrants be eligible for federal SNAP benefits outside the coronavirus, like unemployment, Medicaid, and SNAP?
Yes.
You can hear people at home right now going, but they're not in this country, they're undocumented, and that to a lot of people will seem unfair.
And many undocumented still pay taxes, and their well-being is linked to ours. Yes.
All right, Mr. Markey, Rebecca's question to you, she was asking about unemployment benefits during the pandemic for undocumented immigrants.
Yeah, and this is a big issue and something that, you know, I talked to Mayor Bob Sullivan up in Brockton about, and it's this immigrant community, the need for them to get the kind of care they need at their medical institutions, at their community health centers, and I've been partnering with him and the city to make sure they got the resources which they needed. And on the question of giving benefits to these undocumented, from my perspective, that's what the goal was of Senator Kamala Harris and Senator Bernie Sanders when we introduced our bill to give $2,000 to each individual. For a couple, it would be $4,000. If they had a child, $6,000. So that they would have a way on a recurring basis, month after month, to get that check to make it through this incredible
crisis. You mean in another round of stimulus?
And we made sure, very clearly, that any undocumented immigrant that paid taxes would qualify for that program. Because that was the core of what Kamala Harris and Bernie Sanders and I want to accomplish with this program, and we're going to fight very hard in this next round of a debate with Mitch McConnell and Donald Trump on the floor of the United States Senate to make sure that that program becomes a reality for undocumented immigrants.
Mr. Kennedy.
I think folks need to read the fine print of Mr. Markey's legislation, because he has far more faith in the Trump administration than I do. The bill that he's authored lasts for 3 months, after which the Secretary of Health and Human Services deems there is no longer a public health emergency. So, Senator, maybe you have far more faith in Secretary Azar than I do, but I don't trust this administration with anything when it comes to this virus. They lie about it literally every day.
This public health crisis is going to go on for months, maybe years. And that was the goal that Bernie Sanders and Kamala Harris and I had.
But it doesn't mean the Secretary is going to say that.
It was to make sure that there would be coverage for every family until it was over. And yeah, I don't deny that Donald Trump is a serial liar, a racist, but at the same time, there will be no objective analysis that would be able to conclusively say that the pandemic is over, and it would be impossible as a result for our program to be stopped. There would be a firestorm in our country if all of a sudden the president decides it's over. And so I look forward to that debate. I look forward to him trying to take away $2,000 per individual at the height of a pandemic that's caused a Great Depression level unemployment crisis in our country. That's the kind of debate, actually, that Kamala Harris and Bernie Sanders and I want on this issue.
Why did you give the Secretary of Health and Human Services and the Trump administration the authority to actually regulate that program?
Look, we're in a pandemic. We're in a Great Depression. We have both going on at the same time. This piece of legislation is something that's giving hope to families across the country that they will have the New Deal-like relief which they deserve, the
Senator,
FDR moment.
Senator,
and
if that's the
ultimately,
case,
it will be, honestly, it's going to be impossible, even for Trump, to contend that the crisis is over when thousands of people, tens of thousands of people, are still dying every single month.
Senator, there were hundreds of people protesting and demonstrating outside the White House. He used the helicopters and tear gas to move them out so he could take a photo op. I don't trust him for anything on this. You could have done what we did in my direct cash payments bill, which we introduced months before you did, which was peg it to the unemployment rate. Peg it to some objective measure on healthcare rather than giving the Secretary of HHS the discretion, because I don't trust anyone in this administration with facts.
Listen, I can tell you one thing. Bernie Sanders does not trust Donald Trump. Kamala Harris does not trust Donald Trump. I don't trust Donald Trump. Okay, we know what we're doing. We know how to legislate, and we also know of the political impossibility of what will happen if he tries to declare that the pandemic is over when it's not. Look what happened to him when he decided to walk across the street from the White House to that church and to militarize. The pushback came from every general. The pushback came from ordinary citizens all across the country, and the same thing will happen if this president with the highest prevarication coefficient in history tries to pretend that the pandemic is over. He will get pushed back by Tony Fauci, by every public health doctor, and by the way, by a high percentage of the Republican Party as well, who know that this man cannot be trusted either to deploy the military or to determine when a pandemic has been completed.
Final thought, Mr. Kennedy, 30 seconds.
He still did it.